Hi, I'm Dr. Ilya Sobel.
And I'm Dr. James Young with Urology of Virginia.
And we want to talk to you about Urology of Virginia's Stone Pathway to try to help you get through this difficult time a little bit easier. So Dr. Young, what's Stone Pathway?
Well, Urology of Virginia, approximately 2 years ago, we recognized that we needed to do a better job with patient access and speeding up care for patients who have kidney stones, who have stents, and we've made a dedicated effort to help streamline the process within Urology of Virginia.
Yeah, there's been quite a large number of retirements and in general not enough urologists in this region. So what can you expect going through the pathway that may be a little bit different than what most people expect about seeing one doctor and having a preference of a hospital?
This pathway is established because there aren't enough of us around. You might see an ER provider and get a direct referral to Urology of Virginia, and it will be with somebody that is facile and is fluent with discussing kidney stones with you. It might be a physician, it might be a different physician that you saw when you had your stent put in, or it might be a PA or a nurse practitioner that can help guide you through. As we get a referral that you have a kidney stone, we will set the ball in motion, anticipating you'll need surgery, some x-rays, and follow up with providers.
Yeah, and sometimes folks have pretty strong interests in being in one location or not. If you really push for that, what do you think that will do in terms of timing?
It might slow your care down slightly. We are trying to fill in the blanks, trying to fit you in with with a provider that can help you as soon as possible.
So it sounds like the goal is to try to figure out how to get people to move through this process the quickest possible way without having a long time with a stent, without having a long time with a stone. But it may be at a facility that's different, it may be with a physician that you haven't met before, but the goal is to be healthier and happier.
And provide good care. Ilya, could you explain why kidney stones hurt?
A lot of people think stones hurt just because they're inside the kidney, but the reality is that stones hurt when they obstruct the flow of urine out of the kidney. So somebody could have a little stone sitting here in the bottom of the kidney, and if it's not blocking anything, you probably wouldn't feel it. It's possible to have a very large stone in that location and have no symptoms whatsoever. But when that stone then decides to move into this little tube called the ureter and cause a blockage in this location, now the urine that's made by this kidney can no longer get out. And that's what causes the excruciating pain that so many people go to the emergency room for.
Where might people experience pain?
Well, most of the time it's in the back, kind of on the side of the back, but you can sometimes have the pain as well in the abdomen on that same side, as well as when the stone typically will go a little bit lower and closer to the bladder, you may experience it even in the pelvic region.
So Dr. Sobel, what would you expect if you had to go to the emergency room? Tell me about the emergency room experience, and then what Urology of Virginia will provide for you after that.
So once you're in the emergency room, oftentimes certain testing will be performed, urine tests, blood tests, and most importantly a CT scan. And so that will show us exactly what's going on. Very often people can have pain and it's not related to a kidney stone. We may identify kidney stones at that time, but again, if they're not obstructing the flow of urine out of the kidney, it's very unlikely that that's the reason for the pain. But if we find a stone that's in the ureter itself, we can oftentimes see that the kidney will be swollen. All that urine can't get out. So from that moment, we need to sort out what to do. If the stone is small and we think that typically the patient can pass it, then hopefully we can get the pain controlled and have them go home and try to pass the stone with a short follow-up with us in the office. If on the other hand, even if the stone is small, but the pain just does not get any better, then we have to make a decision of what to do. And oftentimes it's difficult to proceed directly to stone treatment in that scenario. It takes up to 2 to 3 days to get a urine test that comes back as a culture that says that there's no infection for sure. We do get some preliminary tests that may give us a hint, maybe there's an infection or probably there isn't, but given that it's not safe to remove kidney stones if there's a possible infection, our options at this point are A, to put in a stent, or B, wait until the urine culture comes back. So if we put in a stent, and we'll talk more about this later, That's going to alleviate the obstruction. It's not going to remove the stone, but it'll make the pain feel better because the kidney can now flow. On the other hand, if we wait until the urine culture comes back, then we can talk to you about options for stone removal or stone treatment by whatever procedure that might be. The problem is not everyone can wait those 3 days for the urine tests to come back definitively, so it's a conversation about your pain level and what makes the most sense at that point. So if I'm in the emergency room and we can see that there's a stone and it's obstructing me, why can't we just go right to removal of the stone right away?
There are various reasons for that, and that is one of the more common questions we get, and one of the more common pieces of frustration for patients is they want to have their stone taken care of immediately. Most commonly, there's a sign of infection in the urine, and even if there's not signs of infections, there could be some infection blocking behind the stone, which could cause patients to get sick.
Well, that could be really dangerous. The issue is that during the procedure, very often, we're taking a camera and driving it up the tube to the stone, using a laser to break it up and removing the stone. There's other procedures as well, but I'm using this one as an example. And there's a lot of pressurized fluid that's actually coming out of the camera during the procedure. So if there's infection in this part of the kidney above the stone or the urine that's not able to get past, then what will happen is that infection, the bacteria that's in the urine, will get pushed directly into the bloodstream, and people can get very sick, something called sepsis. So we really need to take this extremely seriously, and even if there's a minor concern for a possible infection, the best thing to do is to proceed with drainage of this urine with a stent, which will go around the stone from the kidney to the bladder, drain the urine, treat with infection, and come back in a few weeks to potentially remove the stone when it's safer. The preliminary tests, the quick ones we get in the emergency room, urinalysis and blood work and CAT scan, we can kind of look at things and say, well, there's probably not an infection or there's maybe an infection. But is that good enough?
It's not good enough. We do need a urine specimen, which will take 48 hours to completely finalize, and it's a urine culture to determine whether there's any infection there at all. What does that hospital stay look like?
Usually about 2 or 3 days. It just depends on how sick you are. If it's not too bad, then hopefully on the shorter side. But if some people can end up in the intensive care unit.
So putting a stent in requires general anesthesia, and typically lasts 5 to 10 minutes to put the stent in, and probably a 85 to 95% success rate of getting a stent in.
Yeah, and so the rare occasions that we're not able to get a stent in place, we do have a backup plan, and that is called a nephrostomy tube. So we like to avoid this if possible, but sometimes it's the only choice, where that's a tube that goes directly through the back, through the skin, directly into the kidney and drains the urine out that way. If sometimes approaches to try to get around the stone are unsuccessful, we still have to drain the kidney. This is the approach that we may take, but it's something that we keep in the back pocket if needed. So I've heard from a lot of patients the stent is typically the most bothersome part of their experience through the stone journey. Can you talk a little bit about that?
Oftentimes patients feel that they are even worse than having a kidney stone. A stent is a little plastic tube which goes between the kidney and the bladder, and with that, the stent creates its own set of symptoms. The stent can irritate the kidney, creating a little bit of discomfort. And down at the bladder, your bladder perceives it as being full, and your bladder wants to get rid of the stent, and makes you feel like you got to go to the bathroom suddenly, frequently, and urgently. While you have a stent in, there will be blood in the urine as well, and there are a few medications that we can give you that might help alleviate some of the symptoms.
When someone has a stent in the urinary tract, is it normal to have blood?
Certainly it is. First, there's the surgery. There'll be blood from that. Secondly, the irritation from the stent and the stone could create some episodes where blood will be noted periodically. And then the irritation within the kidney and the bladder will cause some blood.
So how do you know when the bleeding is severe enough that you actually need to get help?
Most of the time, it never is a significant problem. Things that would create more bleeding would be more intense activity, exercise, periods of dehydration. Blood is more noticeable in the evening than during the daytime when you're not drinking quite as much. You're not as well hydrated.
Yeah, and I've seen that basically if you're able to pass your urine, that's typically not an issue. If you start to see large chunks and clots and it looks more like ketchup and now it's obstructing your ability to urinate, that's usually a time that you have to head back. It's pretty rare, that's what you're looking for. That's the red flag. If a stent, let's say, alleviates the pain for someone, and let's say they're the rare person that doesn't feel the stent, can it just stay in forever?
The stents will too get calcified and can create their own set of problems. Typically we try to get a stent out within at least 3 months.
Yeah. And what if they stay in a year? I mean, or 2 years, and you don't come back for your appointment? What can happen then?
It becomes a big problem, usually.
So the surgery becomes much larger, and now we're much more complicated when it could have been done very easily if the follow-up was correct.